Hi guys, my name is Krista and I'm a nurse practitioner at Radiant Skin Therapy. And today I want to talk a little bit about filler and some of the common misconceptions that I get asked about from patients daily who are sitting in my chair. I think educating patients is super important as it empowers you to actively participate in your unique journey to achieve your aesthetic goals. So without further ado, let's kind of get into it. Firstly, I'd like to talk about probably one of the most common areas of concern for patients, which is nasolabial folds. Many patients will come in and say, I need filler in my folds here. I think it's really important to know that nasolabial folds are natural and normal. Even babies have nasolabial folds when they're born. So it's not something that we want to totally obliterate if you are looking for a natural result. So when I am assessing a patient's face, I am really looking for where I see volume loss and depletion. Many times when we see deeper nasolabial folds, it can be due to loss of volume in the midface here, so kind of through the cheeks. You will notice when I kind of provide support here, this indirectly will soften. So again, if you lack support from above, you will start to see some of this heaviness in the lower face here. So nasolabial folds, marionettes, jowls will all be a little bit more prominent and noticeable. So as we mature, our face ages virtually on every level. So our bones resorb and weaken. We have healthy fat pads all throughout our face that actually will start to deflate and atrophy. Our skin naturally thins and loses volume as collagen, elastin, hyaluronic acid gradually start to diminish. So all of these kind of contribute to loss of volume in the face. So really what we need to do first is replace some of that bone and fat pad loss, specifically in the cheeks if we're going to correct some of the nasolabial fold area. So what this is going to do is really support the deep structure or the frame of the face. The frame of your face really includes your temples, your cheeks, your jawline, and your chin. So it's really similar to building a house. You need to lay the foundation down before you go and put up the drywall and then paint the walls, right? So same thing applies. We need to support the underlying structures first and then go in and fine tune some of those soft tissues later. So another really common misconception I get from patients is I'm scared cheek filler is gonna make me look overdone or unnatural. And I think social media and TV and Hollywood really doesn't help that common misconception. But I like to tell patients that when you go in and you support the structural areas of volume depletion first, that will provide the most natural result. On the other hand, if I were to go in and first go into the soft tissues and try and buff those out and neglect the deeper areas of the face that really do need that support, that's when we risk looking overdone. So I think that's important for patients to know. And I think another reminder is that filler can be a journey. Many times it takes multiple sessions to really get to our overall goal. Doing treatments in increments over a period of time will also prevent patients from looking unnatural or looking overdone because it's a gradual kind of subtle process. Our approach here at Radiance is safe and natural. We never want to alter your appearance in any way. We just want to enhance the beautiful features you have and allow you to kind of age gracefully. So I hope this was helpful in kind of clarifying some things and some of the confusion that exists out there surrounding filler. And thank you for watching.